So there's a lot of buzz going around about RFK Smile, especially because, he is not an advocate of fluoride use for decay and disease prevention. The photo that was taken, there's something weird in there. It looks like he'd had maybe even a gum graft procedure, and there was maybe some surgical dressing or wound covering that was in there. Um, I would suspect that that's what happened because he has a lot of gum recession in general, which is not uncommon for someone his age. The other thing that's noteworthy, he has a lot of wear on his teeth, and so he's worn through enamel. He's into the dentin and most of the teeth that you can see. The function piece of that, there's obviously going to be a functionality issue with what's going on there, and so it's hard to say if he actually has any decay or disease without having X-rays, but certainly a ton of wear and tear on those teeth for a number of reasons. Almost daily, patients that walk in that have teeth that look like his that are coming to me to fix them, right? And so I think he would benefit from some cosmetic restorative dentistry for sure. In his case, he's a pretty busy guy, right? And so he obviously is doing a lot for other people. And oftentimes individuals like that neglect themselves, right? And I think he does a pretty good job taking care of his physical health. I think he's ignored his dental health, right? And so he would be someone that if I met him, 15 years ago, we would be talking about, let's get a night guard, right? Let's get something because you're doing some clenching there. Something's wearing those teeth down. We talk about potentially looking at gum grafting sooner rather than get it to the point where he's at now, where he has significant recession. So being a little more proactive so we don't get so much root exposure and then just managing other side effects. Like for example, if he is really hard and clenching hard, and he's got pretty well developed masseters like I do, potentially some Botox in the masseters to help with that, which I do. I get Botox in my masseters. So there are things like that that I think would help him tremendously, and that would have been helpful a decade ago. And now he's at the point where we're kind of in repair mode. And like I said, I think some cosmetic restorative dentistry would help him a lot at this point. So as we age, a few things happen. Wear is normal and inevitable for all of us. How much wear we get is really dependent on environmental factors to a certain extent, like what we eat and drink, the acidity of things that we eat and drink. And then certainly there's physiological factors like clenching, grinding, habits like chewing on your fingernails or chewing on ice, things like that come into play. So all of that comes into play with the wear facet. Once we've worn through the enamel and we're into the dentin, that's where wear is a problem. The wear rate of dentin is about 4 to 6 times greater than it is of enamel. So once we've worn through the enamel and we're in the dentin, the teeth wear a lot faster. Obviously a problem. So we need to be proactive if we're seeing that happen to stop it or manage it before it gets to that point. Once it's to that point, now we start talking about treatment options and we look at bonding, veneering, things like that. The other thing that happens, our teeth will discolor over time. And again, there's a lot of factors involved with that. We could talk about that another time. But some people, as we age and our enamel thins, whitening doesn't really work anymore. So I have a lot of my patients, that are a little older and say, hey, look, my teeth, they just won't whiten and they're getting really dark and dingy and I don't like them. And so again, that's where the veneering comes into play as a great option to help those patients. The other thing that we look at with aging is going to be gum recession. And there's some links to that to clenching and grinding, which I think is the case with RFK. But gum recession is something that, again, we want to be proactive with. We want to be able to treat while it's an easy solution to fix, as opposed to we've lost so much gum tissue that now sometimes in some cases, there's nothing we can even do about it. If RFK came into my practice, which I hope he does, first start with some plan and design, right? He has some asymmetry to his lips and his smile in general, but his teeth don't really match it in an aesthetic way. And so we talk about building out one side, just getting some harmony from right to left with his smile. And then I would absolutely recommend veneers for him. I think that would help correct the wear issues that he has, the discoloration issues that he has, and also we could mask a lot of that gum recession. So ultimately, he would have a more balanced, healthier looking smile a man like him should have. When we look at how do we treat wear and how do we treat asymmetry, I mean, number one, we gotta stabilize the whatever caused it to happen in the first place. So whether it be an alignment issue, a neuromuscular issue, a joint issue, we have to kind of get to the bottom of what's causing it in the first place. So once that's done and we know what's causing it, we know how to prevent it from happening further, that'll help dictate the next step. So if it's minor wear and it's not even necessarily an aesthetic issue, sometimes we can use just bonding and think of it like spackling, right? With this composite material, just replace what's been worn and stabilize the bite. That works in probably the minority of the patients that I see. The majority of the patients I see, because of the wear and the functionality issues, we're using ceramic to reconstruct the tooth structure, rebuild things, and get it to look a lot nicer, more balanced, more symmetry. And in a lot of cases with wear, and I think RFK might even be one of them, as the teeth wear down, the bite collapses, which pretty significant ramifications just on how the mouth works and the stress on the joint, but also changes our face. It changes the way that our face looks because everything kind of starts to shrink in. So in a lot of cases like his, not only are we, kind of resurfacing the teeth that you see with the veneers and making things look better, but we're also resurfacing the back teeth and building the bite back up to where it's supposed to be to help stabilize the joint, stabilize the bite forces there, and also, get a little bit of a facelift out of it.